XBB COVID variant presents a unique threat study. While the US and other countries focus on the increasing footprint of some variants of the Omicron, interrate of COVID-19 BQ1 and BQ11 healthcare systems here and around the world might also want to keep a wary eye on yet another subvariant XBB. Japanese researchers say in a preparatory study published today that XBB exhibits a unique path into existence not seen before in COVID-19 variants, and this gives it more of a profound resistance to antiviral humoral immunity induced by breakthrough infections of prior Omicron subvariants. Their findings were posted and on mid-April, a website featuring studies that have not yet been peer-reviewed. XBB was the first identified by researchers at Peking University in Beijing in September, and one of the authors of that study said that XBB is currently the most antibody-invasive strain tested. The study unveiled today by researchers with the University of Tokyo bluster and assessment, stating that to our knowledge, this is the first documented example of SARS-CoV-2 variant increasing its fitness through recombination rather than single mutations. Recombinations means that joining of variants that arise from two genetically distinct parental strains, creating opportunities for vira to adapt to and escape from antibodies and other genetic roadblocks, be they produced by scientists or nature. Recombination presented a significant challenge in the early days of the fight against HIV or AIDS. Kevin Kavanaugh, MD, is the president and founder of the patient advocacy organization Health Watch USA and has kept a close eye on COVID-19 throughout the pandemic. Kavanaugh told Fierce Healthcare that the most disturbing finding in the study is that this virus is a recombinant virus where two different genomes and or genetic materials from viruses were recombined as opposite to a transmutation. Kavanaugh pointed out that the U.S. healthcare system currently deals with the triple demic of influenza, respiratory syncytial virus, and COVID-19. Kavanaugh said how in the summer, Texas Children's Hospital had to deal with about 25 cases where children had been infected by RS and COVID-19 at the same time. If viruses can start swamping genetic material, then the sky is the limit on the number of variants and the various characteristics which may be produced, says Kavanaugh. XBB is not as lethal as the Delta variant. The deadliest iteration of COVID-19, but it is as lethal as BA.275 according to the study by Japanese researchers. The study notes that XBB first emerged in the summer in India and its neighboring countries, but health systems should not consider XBB as a regional problem, and this variant has a potential to spread wild in the near future. XBB's presence in the US is growing rapidly and now makes up 18.3% of new cases as of the week ending December 24, according to the Centers for Disease Control and Prevention. That's a sharp increase from the week before. University of Tokyo researchers said that XBB is required to sense of a pair of immune escape associated and infectivity enhancing substitutions by only one recombination event. However, the two sets of the substitution pairs would be one of the causes why XBB shows higher rate than other Omicron subvariants. Together, although XBB emerged via a unique evolutionary pathway, our data suggested that XBB also follows the same evolutionary rule with other Omicron subvariants. The R0 and the R0 estimates a percentage of contagiousness, accounting for biological features as well as the behavior of individuals, where is the same as the R0 minus the assumption that everybody is susceptible to infection. The study said that although various local variants, including XBB, have simultaneously and convergently emerged in the late 2022, local variants showing a higher transmissibility will eventually spread to the whole world, like XBB. Therefore, continued in-depth genomic surveillance and real-time evaluation of the risk of newly emerging SARS-CoV-2 variants, even though considered local variants at the same time of emergence, should be crucial. Kavanaugh suggests that a virus created through recombination can make huge leaps and bounds in changes in its characteristics in a very short period of time. The fact that this has been observed is even more concerning than this virus itself.